Time for the daily briefing here on Wednesday, August the 12th. And not just me today, but we are back to having one of our very knowledgeable guests. We're pleased to welcome Dr. Sanders back to give us an update on the dashboard, on testing, some changing testing times, the travel deal, and a little bit of rumor control. Daily briefings at 1 p.m., 5 p.m., and 8 p.m. or thereabouts on KLAM and KCDV, and uploaded after they're updated to youtube.com/Cordova TV. So, Dr. Sanders, I was looking at the COVID box score, as I've come to tell it, or come to refer to it in my own head, and I'll say it out loud when the numbers are good. How does it feel to be back to zero?
It always feels good. The more important thing that I like to see is that no new positives in our community over the last 10 days, and that's getting us close to that no new cases in the 14-day time period that we monitor. And that's what it takes to get the coronavirus to leave our community, and I'm looking forward to that. Yeah.
Well, and with the increases, we've got this change in the travel rules, the testing rules for non-residents coming in and so forth. So hopefully, if that works as designed, it'll increase catching cases that might be coming in. But I would assume that the exuberance comes with the warning not to get complacent and say, "Oh, we're back to zero. Now we can just willy-nilly, we can all go lick each other and whatever."
We haven't even got to the place where we can roll back and say, okay, now we're to level 2. We really are waiting for that 14 days of no new cases before we start to even change how we think of the risk level that the community's in. So we certainly still want people paying a lot of attention. The travel guidance, although it has changed, we have been testing new arrivals from out of state for quite some time now.
Yeah.
And the new guidance is just to help protect our local testing supplies. We really hope that people that have any passengers, friends, or travelers coming from out of state, to encourage them to use one of the pre-travel testing options so that we can protect our supply here.
Sure.
The pre-travel option, there are some of the Everlywell or the other companies that are offering at-home test kits. Those are fine to use for the pre-travel option. People just have to do the test 72 hours prior to boarding their first plane.
Okay. And on the subject of testing, we've got some changes to schedules and so forth being implemented. What should people expect with the local testing regime?
So knowing that we're going into a high tourist season with the Silvers hopefully coming soon to Cordova, we have increased our testing at the airport to 7 days a week, and we'll be doing that for a little over a month, 7 days a week at the airport. We also have adjusted our in-town community testing. It will only be available 4 days a week. It's going to be Monday and Friday from 2 to 3 p.m. at Alanka Community Health Center, and Tuesday and Thursday from 9 a.m. to 10 a.m. at the hospital ambulance bay.
Is it still a situation where you want the testing at the airport to just be for the passengers coming in, that folks in town, again, in order to keep things running smoothly and stretch out supplies, folks in town should not drive out to the airport on one of these other days to get tested?
Yes, the airport testing is only for new arrivals to Cordova. That is, the nurses out there have very strict instructions to only test new arrivals. The community testing, the periods on that we just talked about, are the ones that we want people coming to for any other testing. Now, testing can be arranged. If people are having symptoms, we want them to contact their provider right away and discuss when the best time to test would be. That's always an option. For all of the community testing, there is one additional change. We've always asked people to bring their IDs. We're also asking them to bring their insurance cards. We will be submitting the test to insurance, so patients might get an explanation of benefits in the mail. That is not a bill. It's just an explanation of what their insurance provided them, the insurance coverage that they got. And any balance that's not covered by the insurance will not be, it will not become the patient responsibility. The community here has decided that we are going to use CARES funds to cover the additional testing fees that aren't covered.
Okay, so it's still basically free, but by people bringing their insurance, it helps the community to recover some of the cost?
Yes.
Okay. So, again, please bring your insurance to the local testing, your insurance information, but don't expect to be, you don't want to dissuade people from testing, so we all want to emphasize that bringing the insurance does not mean you're going to have to start, that you're going to get billed. It just assists with the local costs for it. Okay.
Exactly. And we don't want to dissuade appropriate use of testing. It still is very important, though, we do utilize our supply as indicated, so that people that were in contact with somebody that's a known positive or recent travel, there are some critical infrastructure employee plans where we have testing requirements prior to people going to work. And those plans would already be filed with the city and have agreements with either the city or the hospital to get that testing done. So it's really the contact tracing. If people are feeling sick, having any kind of symptoms, we want them to contact their healthcare provider. Okay.
All right. Well, since we haven't spoken in a while, are there any sort of frequently asked, for example, there was some talk about, as there, that used to be back in the chickenpox days, there are people that out there still that think that in order to achieve herd immunity, that it's better to actually be exposed to one another. There was some chatter about that. What is your position on whether that's a good idea?
I have heard and been asked by a couple of young people if they should go have coronavirus parties. We've certainly all seen on the news that those don't go well.
Yes.
We are absolutely not encouraging people to gather together to develop coronavirus immunity. We want to keep our case counts low. We don't know the long-term impacts of this illness, and we are not encouraging people to try to get this illness.
Plus, I would assume that if somebody tried to do that and, they were all trying to give it to each other among themselves, you have the problem, as again we've seen in national stories, where somebody will do something like that and then they'll end up passing it on to somebody vulnerable within their family or not within their family. So that adds to why it's a bad idea in theory, right? Because it's not just the people that are doing that are potentially impacted.
Exactly. If this was easy to control and contain it to small groups and individuals that wanted to be sick could get sick, we wouldn't be in this position. This is impossible to contain once it's spreading. And the way that we can mitigate our community risk is to help not spread this illness. Okay.
And again, it's nice, at least at the time we're having this conversation, to be at 0. But again, that can change. But again, it doesn't necessarily have to change if we all continue to take our responsibility. Does that continue to be your position, to remind everybody that really the power to keep it from spreading is with the folks?
Yes, absolutely. I think we've got the policies in place here in Cordova. The community is doing what we can to mitigate the risk of this virus spreading. I think we're doing a good job, and people just need to keep up with the cautious behaviors, the social distancing, using a mask, and washing hands frequently. It's proven to work well for Cordova so far, and hopefully everybody can just stick with it and keep going. I know it's hard, but you guys are doing an excellent job.
If only the rest of the world was as smart as Cordova, Alaska, or I guess as well situated. So anything else you want to leave us with?
I think that's it. I really appreciate the community's support on this, and keeping Cordova COVID safe, as they say.
All right. Well, thanks for the chat, and you stay sane as well.
Thanks.
All right. Thank you, Dr. Sanders. And a reminder again now, the changes in the local testing times, 4 days a week, Mondays and Fridays from 2 to 3 at Alanka, Tuesdays and Thursdays from 9 a.m. to 10 a.m. at CCMC, unless you have symptoms. Airport testing going to 7 days a week to accommodate the state's new requirements. Please remember to bring that insurance when you're having testing. It won't generate a bill for you. Remember, too, that Alaska Airlines, unless it changed and I didn't see anything about it, Alaska Airlines has a mandatory masking rule for anybody over the age of 2 regardless. So if you are planning to fly out or fly back, if you're maybe listening to this online from outside and headed to Cordova soon, remember that you have to have your mask on during the entire flight, nose and mouth, or risk not being allowed to fly with Alaska Airlines. So they've gotten pretty strict about that. We will have the next round of daily briefings tomorrow in the 1, 5, and 8 p.m. hours, uploaded as always to youtube.com/Cordova TV. We thank Dr. Sanders again. We hope you have a great day as we get back to regular programming on the Clam and the Eagle.